Pleasure to be a part of this year's Skin of Color Society Annual Symposium. I'm Seemal Desai, the immediate past president of the Skin of Color Society. I'm in private and academic practice in Dallas, Texas, and it's really a privilege to spend the next few minutes talking about an important issue within dermatology and something critical for our organization as we continue to grow and evolve, which is advocacy for our specialty. If you have any questions or comments after the talk, please feel free to reach out over social media or email at Seemal Desai MD. These are my disclosures. I do perform clinical research and consulting in the areas of skin of color. I also serve on the FDA. However, I need to disclose that prior to the talk. I will be speaking today from my own perspective and some of the advocacy work I've been involved with through the AADA and other organizations. And I thought the importance of this talk was really about how to get involved with advocacy and why should you, as a SOX member and a leader in skin of color, also be involved in advocacy, even if your passion may be something more clinical or research. And I think the critical thing we need to talk about as an organization as SOX continues to grow is the fact that we are now a bigger and bigger player at the dermatology table. The relevance of the Skin of Color Society, the relevance of skin of color dermatology, the relevance of diversity, equity, and inclusion continue to increase leaps and bounds as we continue to navigate all the challenges in society. So advocacy is not only broadly a really critical opportunity to help our specialty, but it also helps as we're trying to advocate for payment reform, for aesthetic and procedural safety, for coverage on medications, for helping the uninsured, helping underrepresented minorities advance in medicine, recruiting a more diverse workforce into dermatology and more board-certified dermatologists of color. This is a key way for us to make these things happen. Research helps, data helps, clinical studies help, but you have to be involved with advocacy with policymakers, both at the federal, state, and local level to really affect this change. And this is something that I've been very passionate about for many years, as many of you know, and I hope that this brief update on some of the things that our other dermatologic societies are doing helps us to also advance this for Skin of Color Society. So a few of the things I want to briefly touch on. One of the important things that's happening right now is an increasing emphasis and work on the dermatologist-led team. The Academy has done a really fantastic job of promoting the board-certified dermatologist-led care team, which is really critical because in many states now we have independent nurse practitioner private practice bills, where nurse practitioners in some states such as Oklahoma and Tennessee and Louisiana and Pennsylvania can actually practice independently, and they're not MDDO physicians. They're not board certified, they haven't been trained in medical school, and the list goes on. The dermatologist-led care team and the importance of a board-certified dermatologist is really critical because of scope of practice issues. We have dentists who are doing aesthetic procedures. We have physician assistants who are doing aesthetic and surgical and other skin-like procedures in many states that they're doing independent of a physician. And we all know about the poor outcomes. Compound on top of that, the importance of knowledge of skin of color, which clearly is something that even in the board-certified dermatologist community is not wide-reaching. Imagine the lack of knowledge at these mid-level provider, independent mid-level practitioner levels who really can do detriment and harm to our patients. So it's really important that we take a stand on this as an organization, and you as members become involved of promoting credentials, knowing what you're doing, being out there in media, in social media, and in publicity, and with your patients and your local medical societies about what is a board-certified dermatologist expert in skin of color and how we are helping transform and save patients' lives versus these independent practitioners who aren't even doctors. Medicare reform is another really important area. The AADA has been really active in fighting for fair physician payment. Specifically, as you all know, Medicare cuts were going to happen this year. The Medicare payment cuts would have been more than 10% that were scheduled to take effect in 2021. Through the AADA and joint advocacy with the AMA and other organizations, those were averted. However, our work is not done here. We need to continue expressing to CMS, which is the Center for Medicare and Medicaid Services, about the pandemic we're dealing with, how we're trying to preserve access to care, hold them accountable to make sure we can serve our Medicare and Medicaid populations. This is especially important when we talk about congressional policy related to Medicare cuts, and also this continued multi-year effort through AADA and other sister society organization at the CPT code level and the RUC level for making sure the codes are valued for the services we provide. Compounding, I think all of you know I'm super passionate about compounding. We really have been active on this. I have the privilege of serving as the chair of the AAD's compounding work group, where we have been successful in obtaining exemptions from the FDA on restrictions on compounding, everything from buffering your lidocaine to diluting your triamcinolone. All of these things are part of our multi-year strategy to preserve in-office preparations of medications, which we've been doing for years safely and effectively for patient care. We've also continued our work at the USP level to secure a dedicated monograph through the US Pharmacopoeia, so buffered lidocaine doesn't have to go through these onerous, unsubstantiated ways of being prepared in the office as they would in a pharmacy. And the AMA House of Delegates has also adopted policy led through the Academy in terms of compounding and our need to preserve this for dermatologists. And finally, improving access to care broadly, I think, is so critical because we as SOCS represent the skin of color community, the underrepresented minority community, the diversity community, making sure we have improved access to board-certified dermatologic skin care through better access to generic medications, simplifying the prior authorization process, lobbying in Congress for drug transparency and fixed drug pricing, and also making sure that we continue to fight step therapy issues. So step therapy legislations have been passed in South Dakota, North Carolina, and Louisiana, and step therapy we know is extremely detrimental to many of our patients. And imagine what we know when our skin of color patients already have a reduced access in many communities, particularly our underrepresented populations, from coming to a board certified dermatologist. They finally get to us, they get to our offices, we're trying to treat their psoriasis or atopic dermatitis or severe acne or the litany of other diseases, and you still can't get them a medication. So they've already had so many hurdles just to get to us, and then we have hurdles getting them the right treatment. This is why we need to be involved and why we have to be active vocal advocates for our skin of color community. In closing, these are critical opportunities in advocacy for diversity, equity, inclusion. Not only is this part of SOC's mission, but this is a broader opportunity to help all of dermatology. We really need to use our influence to expand awareness of diversity, equity, inclusion, and how that it combines with our mission as a Skin of Color Society. And I would really encourage you to remember the old adage, if you're not at the table, then you are on the menu. And that is so critical to everything that I've seen in my advocacy work. And I hope that this motivates some of you to become more involved in your part of advocacy, be that through your local medical society, the American Medical Association, your local volunteer group, the NMA, the AAD, the ASDS, the list goes on. But no matter which group you choose to work with, let's give back and do something, because we need to increase opportunities for our minorities, our URMs, and our members. In closing, I thought I'd close with our SOC slide because diversity in action is truly what we're about. And I hope that this advocacy update has been helpful, and hopefully we can continue to give more of these updates as SOCS continues to advance in our relevance and in our reach. Thank you so much for this opportunity to address you today as a part of this year's 2021 virtual meeting. Please feel free to reach out on social media at Seemal or Desai MD. It's been my honor and privilege to serve as your president and immediate past president, and I look forward to continuing the amazing work that SOCS does for our patients, the public, and our members. Thank you, stay healthy, and stay well.